Hi, my name is Leanne Brown. I'm the Business Development Manager and a Program Consultant here at Star Services. One question we commonly get in our consulting department, our training department, and our online training department is, what training do I actually need? Also, when do I need it? And what do you offer that meets those training requirements? Hopefully I'm able to clear that up for you today. We've actually created a pretty handy chart that you can use, print it out, and reference it whenever you need to know what trainings you need and when. We are going to go over two training areas today: orientation training and annual training. So let's get started with orientation training. The first thing a person needs to have is a job description and job functions. They need to be trained on exactly what they are going to be doing in their job, and they need to have that signed in their file. You don't need to do this every year, just as a person's job changes. The next area you need in orientation training is responding to and reporting incidents. This class is covered in our documentation online course. It's also covered in our live orientation to providing quality services course. Keep in mind, with this required area, you also need to review your company's specific policies. You have to make sure that in addition to the general standards of 245D responding to and reporting incidents, that the people that are working for you know what your company does in those instances. The next area is safety practices, as established by the license holder and 245D.06. This really relates to bloodborne pathogens and universal precautions. This is something that you need to have, again, with your company policy, but also our online training course, Bloodborne Pathogens, will cover this area. This is also covered in our first aid course and in our orientation to providing quality services live courses. The next area is your current policies and procedures, including the location, how staff can access them, and their responsibilities related to your policies and procedures. Now, we don't have any courses for this because it's company specific. You need to make sure your staff are trained on your policies and that they know what they need to do related to those policies. The next area is Minnesota data privacy and HIPAA. This is covered in our online course, Data Privacy, and in our live course, Orientation to Providing Quality Services. The next area is service recipient rights, including staff's responsibility related to these rights. This is covered in our online rights course and again in our Orientation to Providing Quality Services live course. The next area is maltreatment of minors and the Vulnerable Adult Act. Now, this is important to know. You need to make sure that your staff are trained within 72 hours of first direct contact on this area. We often get questions of, what should I prioritize, or which training area should I do first? Really, for this one, it's very important that you get it done as soon as possible because it has to happen within 72 hours of direct contact. Now, how do we help you cover this area? We go over this in our online versions, Vulnerable Adult Act and Maltreatment of Minors Act, as well as our live course, Orientation to Providing Quality Services. Keep in mind, there's some additional requirements for the Vulnerable Adult and Maltreatment of Minors Act courses. You need to train your staff on your company's specific practices, including who they can report to as internal reporting persons. An area that's commonly missed under the Vulnerable Adult Act and Maltreatment of Minors Act is making sure that your staff are trained in your program abuse prevention plan, if you have one. The next area is person-centered practices. This is actually covered in the Positive Supports Rule core training. We offer that both live and online. Next is first aid. Now, this course you can either do annually by doing a first aid manual or reviewing an online course, or if a person gets certified and they get a card from the American Heart Association or maybe the Red Cross, those are usually good for 2 years. So if they have a card and it says it's good for 2 years, then they only need it every other year. For first aid, we don't currently have an online course, but we do have our live courses that you are more than welcome to attend. Now let's talk about CPR. This is an area people often get confused in. CPR is actually only required if it says that it's required in a person's CSSP or their CSSP addendum. There's nothing that says that all staff who provide 245D services have to be trained in CPR. Again, only if it's listed in the person's CSSP or CSSP addendum do you need to train your staff in CPR. Again, we don't have this available online, but we do have it in a live course. The next area starts going into person-specific training. You have to train your staff in the person's CSSP, their addendum, their IPP, their SMA, and all their other person-specific documents. So make sure that you are doing that. Of course, we don't have any classes that go over that because it's about the person. The next area is medication administration. Medication administration is required if staff are administering meds. If they aren't administering meds, then they don't need to have it. Keep in mind, you have to do an observed skill assessment as well. We have the first part of medication administration available online, and then we have Meds Part 2 available live, where one of our nurses will go over the observed skill assessment. The next area is emergency use of manual restraint and prohibited procedures. Again, this is covered in the core Positive Supports Rule training. Now let's talk about the Positive Supports Rule core. This training is required prior to assuming responsibilities related to the Positive Supports Rule. Again, this is one of those courses that you should take right away. When you're prioritizing what should staff take and when, that Positive Supports Rule core should be one of the first things they do because they have to do it before assuming their responsibilities. So with the core, there's a bunch of topics in there, and as you know, it has to be 8 hours. If your company allows restraints, the person needs to both give and receive restraints. Obviously, we can't do that online. So we have a live course that's developed to supplement our online 8-hour core. Now, if a person comes and takes our 8-hour core here live, that emergency use of manual restraint demonstration will be included in that live course. The next area we'll discuss is fraud. You have to take an anti-fraud course. You can either do this online or it's included in our live orientation to providing quality services courses. Okay, let's get back to the Positive Supports Rule. For anyone who is a manager, you have to take a 4-hour function-specific course if that person oversees people who are implementing positive support strategies or if they are writing positive support strategies. So if they're a supervisor or they're writing annual paperwork, they need to take the 4-hour function-specific training. We have that available both online and live. Now for your executives, your license holders, or those who are in charge of ensuring your responsibilities for licensing, those high-level individuals in your organization need to also take a 2-hour function-specific training required in the Positive Supports Rule. Keep in mind, for some people who do direct care, they're also managing and supervising staff, and they're also a license holder, they may have to take the 8-hour, the 4-hour, and the 2-hour because they fill all of those responsibilities. Again, we offer all of those courses, both online and live. The next area is OSHA, bloodborne pathogens. This again is covered in our bloodborne pathogens course online or in our orientation to providing quality services course in person. The next area that's specific to a person is specialized medical equipment that's used to sustain life. If your person that you support uses any medical equipment that helps to keep them alive, things like a feeding tube or trach or anything else, you have to be trained on that specific medical equipment. In addition, that training needs to be done by either a licensed health professional or a representative from the company. Of course, we don't offer that online or in person because it's specific to the person you're supporting. Now, there may be other topics within the person's CSSP that are required that all staff need to be trained on. Make sure you're reading everyone's CSSP and their addendum to see if there's any specific training. Maybe they need a training on seizure disorders or fetal alcohol spectrum disorders or something else that would be specific for that person. Make sure your staff are trained in those areas as well. Now, one training that a lot of people don't realize is required is for people who support individuals who have serious mental illness. If you support someone with serious mental illness, you have to take 2 additional classes. You need to take a suicide prevention class and a crisis response class. We offer both of those classes online, and we also have a mental health fundamentals course that we teach throughout the year that offers those topics. Finally, if you are a community residential setting, there's some additional topics that you might need. However, it's very rare. If a person's CSSP specifically says that you need ADLs, IADLs, and healthy diet, then you must train on them. If their CSSP or addendum doesn't mention these items, then you don't need to worry about it. Now, regarding orientation, a lot of people ask, well, how many hours do I need and when do I need these courses by? In the past, there was required amount of hours within 60 days. That requirement is no longer in place. You need to have all of the topics that I listed within the first 60 days, but there's no amount of hours that those courses need to be, except for, of course, the positive supports rule. So keep that in mind when you're training your staff. One thing we didn't mention is job shadowing. A person needs to do some type of on-the-job skills training, so make sure that is documented in your orientation training records as well.
Regarding annual training hours, in 2019, 245D was revised to remove the requirement for a certain amount of training hours per year for staff. Each staff is still required to have training in the mandatory topics. However, they no longer need to have a certain amount of training hours each year. Keep in mind, the positive supports rule was not changed, so staff and managers still must have an annual refresher that is 4 hours in length each year in the positive supports rule topic areas.
So what topics do they need? We need to have data privacy and HIPAA, service recipient rights, maltreatment of minors and vulnerable adults, person-centered practices, which is included in the positive supports rule courses. For first aid, if you're only reading the manual and it's not a certificate, you need to do that every year. Now, if they have the card that says every other year, you can go every other year. But if it's not a formal certification, you have to do it every year. The next thing is looking at the person-specific documentation. All of the person's CSSP addendums, their IEPPs, those need to be reviewed as revised. So it should be at least once a year. Your core training and your function-specific training, there's some different requirements in there that you need to pay attention to. Each year, if a person has been trained and needs the 8-hour core training, they need to have a 4-hour refresher on those topics. Now, if a person is a manager and was required to have the 4-hour function-specific training, then they're required to have a refresher on that is 4 hours long. But keep in mind, if a person needs both the core and the management 4-hour function-specific, you can actually put those together and have a 4-hour core and function-specific refresher that's all together. We have that available for you online and in our live training. Now, there's no annual training requirement for the 2-hour function-specific, so you don't need to worry about that. OSHA, the bloodborne pathogens and universal precautions, those are required every year. Next, those training topics that are required by the person's CSSP. Maybe again, it talks about staff need to be trained on seizure disorders or fetal alcohol spectrum disorders or anything else. If the CSSP says that staff need to be trained on a topic, they need to be trained on that topic every year. The next area is if, again, that CSSP talks about that community residential setting training, which included IADL, ADL, and healthy diet. If the CSSP or CSSP addendum says they need those topics, then yes, you need to do that every year. Policies and procedures, you need to train your staff as they are revised. Any of the other topics we talked about, you don't need to do annually. So you don't need to do the specific mental illness training every year, unless it's in the CSSP addendum. You don't need to go over incident reporting every year. You don't need to do medication administration every year. So you'll be able to see on the chart that we have provided what courses you need. There's a column that says required annually. Check that column. If it says yes, then you need to do it every year. If it says no, then you don't need to do it every year. Pretty simple. One last thing to note. For both orientation and annual training, it is important to not only make sure the staff have the topic and specific hours, if required, but that they are competent in the subject area and are able to perform those responsibilities and tasks. I hope this helped to answer some of your questions about what a person needs for training and when they need that training. And if you have any questions, you can always feel free to call our consulting department. We'd be more than happy to help you with those questions. Have a great day.